Why this is such an important issue is that over the past 100 or so years, there's been an increasing number of long-term cancer survivors. And this is really due to increases and improvements in screening and better therapies. So in the 1970s, there were about 3.5 million long-term cancer survivors. But by the year 2040, this number is expected to be over 26 million in the United States alone. Now, before joining Memorial Sloan Kettering, I spent 7 years at Johnson Space Center working with astronauts and doing exercise training on the International Space Station. And it was interesting that there are a lot of analogous hits and toxicities that astronauts and patients face. And again, because we're in the more early phase trials and looking at very detailed phenotyping, we had a lot of assessments that required that in-person visiting. And we're looking at how we can address these different layers. The first layer, looking at the behavioral layer, was pretty straightforward with all of the new devices that are now available, where we, in addition to the treadmill and the iPad, we deliver a sleep mat, a scale, a blood pressure cuff, and an activity monitor. And the third level was the biometric level. And again, this was a fairly straightforward solution where we can send phlebotomists to patients' homes. We can send them a stool kit. All of those samples are collected and then sent back to our institution for analysis. So that's a very quick overview of our digital infrastructure we're using to deliver exercise. Given the previous talks, we're also very interested in whether AI can be used to guide precision exercise training. I think we all know that one size does not fit all for many different pharmacological interventions, and we're finding that 150 minutes of exercise doesn't work for all patients either. So we're leveraging all of the data that we are collecting through EMR and our digital phenotyping. We're integrating all of that data, and then we're identifying different subgroups of patients that would benefit from either a lower dose of exercise, a higher dose of exercise, or they may need additional adjuncts like a pharmacological or nutrition intervention.